So here's a patient that came to me last month with a bunch of symptoms, some that had been there for years, but she noticed the change in these symptoms. She had allergy stuff for years and years and years, and it kind of came out of nowhere, she said. And then she's been dealing with skin issues now for the past year. Her sleep has been awful for years because of these issues. Her stool movements, bowel movements are getting looser and more runny and more frequent. And she just feels like she's losing control of what her health used to be like. And so she came in. I noted on her labs that her white blood cells, it's gonna be a little hard to read that, but they're low, they're in the threes. Her basophil percentage was elevated, and then her neutrophils were low. So that's a key indicator that when your white blood cell count is on that low, even when it's around 4.5, that's still the low end of normal. She's even too low, and this is a chronic drain on her immune system. Something has chronically drained. So things to think about when you have low white blood cell count for a few tests, not just a one-time thing. If you've got this chronic white blood cell count, think of a root canal that you might have had in the last year or two, 10, 20 years ago, and it might be festering some type of an infection. The other thing to think of is GI, low-grade GI infections, pathogenic bacteria, yeast, potentially parasites as well. Then the thing that we found with her is that even though she was in a new house, we tested mold on her, and we struck gold with all of these different types of mold species, and the levels were so high. This is absolutely contributing to her white blood cell low count and all of the other symptoms. So we hit the nail on the head. She's excited, I'm excited, and we're gonna go after it. There's a bunch of different things to do with that kind of combination of mold species. So I know you guys are gonna want all that information, but if you want this kind of testing and this kind of approach, jot testing down in the comments, and we'll get in touch with you guys. I hope this helps.